LMX4 cream is used on the skin to relieve itching and pain from certain skin conditions like scrapes, minor burns, eczema, and insect bites. It is also used to treat discomfort and itching caused by hemorrhoids and other problems in the genital or anal area, such as anal fissures and itching around the vagina or rectum. Additionally, it can be used to decrease discomfort or pain during medical procedures or exams, like sigmoidoscopy and cystoscopy. The active ingredient, lidocaine, works by causing temporary numbness and loss of feeling in the skin and mucous membranes. When using LMX4 cream, it's important to follow the directions on the package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Before applying the cream to the skin, make sure to clean and dry the affected area as directed. Apply a thin layer of medication to the affected area of skin, usually 2 to 3 times a day or as directed. If you are using the spray, shake the canister well before using. While holding the canister 3 to 5 inches from the affected area, spray until wet. If the affected area is on the face, spray the medication onto your hand and apply to the face. Do not spray near your eyes, nose, or mouth. If you are using the foam, shake the canister well before using. Spray the foam onto your hand and apply to the affected area. Do not use on large areas of the body. Cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor. These may increase the risk of serious side effects. Wash hands immediately after use unless you are treating an area on the hands. Avoid getting the product in eyes, nose, or ears. If the medication gets in these areas, rinse the area immediately with clean water. The dosage is based on your medical condition and response to treatment. Do not use more of this product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, do not use this medication without consulting your doctor first. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you experience temporary redness, stinging, or swelling at the application site, inform your doctor. Many people using this medication do not have serious side effects, and if your doctor has prescribed it for you, they have determined that the benefits outweigh the risks. However, seek medical help immediately if you experience slow/shallow breathing, seizures, pale/bluish/gray skin, unusual tiredness, shortness of breath, or fast/slow/irregular heartbeat. A serious allergic reaction to this drug is rare, but if you notice any symptoms such as a new or worsening rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. Before using LMX4 cream, it's important to discuss any allergies you may have with your doctor or pharmacist, as this product may contain inactive ingredients that can cause allergic reactions. You should also inform them of your medical history, especially if you have broken skin or an infection in the area where the cream will be applied, as well as any heart disease, liver disease, or blood disorders. If you are scheduled to have an MRI test, it's crucial to inform the testing personnel that you are using LMX4 cream, as some brands of this medication may contain metals that can cause serious burns during an MRI. It's also important to inform your doctor or pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before undergoing any surgery. It's important to note that children may be more sensitive to the side effects of this medication. If you are pregnant, LMX4 cream should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. While this medication can pass into breast milk, it's unlikely to harm a nursing infant, but it's still important to consult your doctor before breastfeeding. When using LMX4 cream, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It is always best to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products. This list should be shared with your doctor and pharmacist to ensure the safe and effective use of LMX4 cream. It is important not to start, stop, or change the dosage of any medicines without first consulting with your doctor. This will help to minimize the risk of any potential drug interactions and ensure the best possible outcome when using LMX4 cream. If LMX4 cream is inhaled or swallowed, it can be harmful. In case of overdose with serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. Symptoms of overdose may include drowsiness, irregular heartbeat, and seizures. Make sure to keep all your regular medical appointments and follow-up visits while using LMX4 cream. This will help your healthcare provider to monitor your progress and make sure the medication is working effectively for you. Additionally, it's important to attend any lab appointments your doctor may schedule to check for any potential side effects or changes in your condition. If you are using LMX4 cream on a regular schedule and happen to miss a dose, just use it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed one and continue with your regular schedule. It's important not to double the dose to make up for the missed one. As for the best time to apply the cream, it's recommended to use it at the same time each day to ensure consistent and effective pain relief. Always follow the recommended dosage provided by your healthcare professional. When using LMX4 cream, it is important to store it at room temperature and avoid freezing it. Keep it out of reach of children and pets. Do not store the gel or foam near high heat or open flame, as this can be dangerous. It's also important not to puncture or burn the container, as the foam or spray canisters are under pressure. When you no longer need LMX4 cream or it has expired, make sure to properly discard it. You can consult with your pharmacist or local waste disposal company for the best way to dispose of it. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.